This episode of Beauty and the Surgeon podcast is brought to you by Let's Get Checked. Let's Get Checked is an online company dedicated to making professional health testing easy and accessible. Let's Get Checked offers fast, affordable, completely confidential at-home health tests from a range of tests from STDs, male and female hormones, and even COVID-19. Listeners of our podcast who are new to Let's Get Checked get 20% off by using our URL, trylgc.com/beauty, and be sure to use the code BEAUTY20 at checkout. That's trylgc.com, trylgc.com/beauty, BEAUTY, and be sure to use the code BEAUTY20, BEAUTY20 at checkout. Do it. Getting tested is important. It's the responsible thing to do, and you know how important I think it is to make sure you understand your labs. Welcome, everyone, to Beauty and the Surgeon podcast. I'm Amy. I'm a nutritional therapy practitioner. I'm joined today, as always, by Dr. Jason Martin. He's a board-certified plastic and reconstructive surgeon. Dr. Martin, how you doing?
Doing pretty good, Amy.
That's good. Today, we're talking all about plastic surgery statistics, which we love. We love statistics.
Yeah.
If you're interested in seeing the slides that go along with this podcast, you can certainly look that up on our YouTube channel at Jason Martin MD. They're statistic-y kind of slides, but it'll be fun.
Yeah, I mean, I love stats. Mm-hmm. My college roommate was totally in stats for baseball. It's to like an annoying level. Now I realize that this is like definitely something good for OCD kind of people like you and I. And I realize that some people may be listening to this episode and be like, oh my God, this is so boring. But the cool part about this is you get to see the trends in plastic surgery. So that's what this episode is really about. Amy and I will geek off the stats, but you can see the trends. Where is plastic surgery going? That's interesting.
It is. Well, and I think in general, even people who aren't interested in having plastic surgery are still interested in it in general from like a, outside looking in kind of like, who are these people getting facelifts? Like,
right.
Who are the people in your surgery hood?
Yeah. Like who's doing it?
Right. What you doing here?
I don't know. I'm getting really close. I want my voice to be very loud.
You're getting really. You were like past it. You were like over the microphone.
That's what I'm doing. I'm a professional. That's what I do.
You're a professional.
You can't beat my professionals.
Yes. So without further ado, let's just jump into the statistics. So we're talking about the plastic surgery statistics report from the American Society of Plastic Surgeons. This is for 2019. It is 2020 right now. So we're looking back at last year.
It should have come out in the spring. I don't know why they delayed it.
Yeah, gosh.
Something else was going on.
Spring of 2020. Not sure what was happening.
Those sons of bitches.
Gosh, yeah. Let's all remember the spring of
ASAPs.
2020. So some interesting things about the American Society of Plastic Surgeons for those who are not aware. It's all, to be a member, surgeons have to meet the following qualifications. So they are certified by the American Board of Plastic Surgery and trained specifically in plastic surgery, adhere to a strict code of ethics, and I mean strict. They literally make us give them all of our advertising, including, now this goes way back in the day, it shows how long we've been working together, but we used to have to give them our phone ads, like our phone listing. They had to see
that was
it
when I was
in a phone book.
That was when I was like board eligible, like going through the process. And we had to divulge everything that we did.
Yep, everything.
And they would go through every one of our ads and make sure it was ethical.
And they still do. It's just a lot easier now because most everything is
By the way,
digital.
I think this is the only society that does that.
Yeah.
Like there's all these people that are like quote unquote cosmetic surgeons. Their societies are like they go something for a weekend and they're like, here's your piece of paper. Yeah. Don't worry about the ads. You can put whatever you want.
Do whatever you want. Yeah, you group on that all you want. They have to have at least 6 years of surgical training and a minimum of 3 years of plastic surgery specific training. And that's really a big difference between someone who's doing cosmetic surgery and an actual plastic surgeon.
Right.
Big difference. You have to meet specific requirements for CMEs for continuing education, including patient safety techniques every year. So that's a different thing too. Like not only do you have to keep up on the plastic surgery part of things, but you also have to be taking updated patient safety training every single year as well.
So I take our in-service exam every year that the fellows take, and sometimes I beat them. And then I beat them down and yell at them and say like, how could you be so stupid? No, I don't say that. But I take that exam and that has all the patient safety credits in there, a lot of them at least. So it's really good. Just this is a side point. It's really not had anything to do with the episode, but being a board certified plastic surgeon takes a lot of effort. You have to really do a lot of expend a lot of energy to keep that board certification.
And you have to recertify completely every 10 years.
And I know these days it doesn't seem like it matters anymore. No one talks about it, but it is important to me personally. It keeps me on the up and up and makes sure it enforces me to know everything that's out there now and to be ahead of the curve, especially on patient safety. So,
yep.
Okay.
It really keeps patients safe. So the quick facts is just looking at the percentage of change from 19 to 18, or from 18 to 19. So there were 18.1 million cosmetic procedures, And this is going to include things that were surgical and non-surgical. Now, I think it's an important distinction to make because a lot of times on this podcast, we talk about in-office procedures as being minimally invasive.
Yeah.
However, for the purposes of this podcast and these statistics, minimally invasive.
Right. In the Dr. Martin Amy world, like minimally invasive is liposuction in the office with you awake.
It is not.
According to these things, it's absolutely not.
That's surgery.
Yeah, that's surgery.
And it really is. And when I say that to people, they're like, well, I'm not having surgery. I'm like, yes, you are. You're having liposuction in the office. You're still having surgery. But when we talk about minimally invasive for these statistics, it's literally meaning things like Botox, filler, chemical peels, laser hair removal, IPL. Like this is literally non-invasive as most people would deem it, not as we deem it.
So if you include every Botox, session, it's 18 million procedures, right?
Right. And the little bits of change, like just as their highlights, breast augmentation actually went down 4%, which was a slight decrease for the first time in a really long time.
What's going on?
Patient education is improving.
Yeah.
Liposuction was up 3%. Eyelid surgery was up 2%, which we'll look more at that. Like historically, eyelid surgery is still down from where it was 20 years ago.
Yeah, but that's because everyone's getting older. Yeah.
Right. Rhinoplasty.
There's less young people too, so that's probably why breast augmentation is going down now.
Yep. Rhinoplasty went down 3% and facelifts went back up 2%.
Let's go facelifts.
Yeah.
One of my faves.
So those are the quick statistics. This slide is kind of breaking down the demographic changes. So men versus women and also age breakdown, which is an interesting thing to look at. Like how many men versus women. Now, as most people would guess, far more women are doing plastic surgery than men.
Come on, tell me the men are coming up.
They are not really. They've kind of stayed static. Not a lot of change.
I mean, so we do tons of gynecomastia, men, right? Male breast growth. We do tons of rhinoplasties, right? A lot of men with that. And we do tons of liposuction, a lot of men. So we have a lot of men in our practice.
We do, but only 8% of the cosmetic procedures last year were men. There was really no change overall.
We need to call up all the men we know. We need to get that number up to 9% next year.
Well, like we talked about, though, in our podcast about plastic surgery for men, a lot of men don't realize that these procedures are options for them. Like, they really don't. Like, it's just...
that patient we did for gynecomastia recently, younger man, early 20s, he said, I thought I was going to have to suffer through this for the rest of my life. And he said, I just started Googling it. And I said, and he's like, there's a surgery for this.
He found our podcast,
that's how he found our podcast. He found this, our episode on gynecomastia.
Yeah.
And that's how he ended up in our office. And he was like, I didn't know this existed. And I was like, are you serious? He's like, yeah. Didn't know there was a surgical treatment for this.
Yeah. Yeah. So I think education's a part of it. Overall, surgery for men was up 2% within like surgical procedures versus non-surgical procedures. Those stayed about the same.
Okay.
So not a lot of change there. Guys, if you've watched our slides before and you've watched our surgery specific procedures, we talk a lot about the numbers. And this is the slide we pull them from. What podcast did we do recently where we didn't have the 19s? Was it rhinoplasty?
Yeah.
It was rhinoplasty. Yeah. So we didn't have the rhinoplasty numbers yet. So I think on that podcast, rhinoplasty was historic, way down from the previous like 20 years.
Yeah. It was way down from 2000.
Yeah. So, and it still is like, that's actually the biggest amount down of any procedure is 47%.
Ah, it's so disappointing.
From
I really think that's because ENTs are doing more of these procedures.
Yeah.
I think plastic surgeons, which is terrible because I was trained on rhinoplasties. I love that surgery. It's one of my favorite surgeries to do. And it's just like you see that maybe it's going to the wayside and, other subspecialties are doing it more. And I think that's probably what's going on. But maybe it's less common.
I think it's that. And I also do think it's a little bit more social acceptance for unusual noses.
Right.
I think that
you got Owen Wilson. I mean, Owen Wilson changed it for everyone.
Yeah, like there could be, or who's that other guy, Gerard Depardieu? He has a weird nose.
Weird. That's an understatement. That thing goes like right, left, left. Well,
so does Owen Wilson's. He has a wonkiest nose. It's hard for me to watch him on, because I'm just looking at his weird nose.
Yeah, he's not really, he hasn't been in movies lately, but that guy has a really weird nose.
Weird nose, yeah. So I think maybe there's more social acceptance of unusual noses. But I agree. I think you can't discount the proportion of that that's going to ENTs or other subspecialties for sure. Yeah.
It's a turf battle.
It is. Yeah. We're going to fight for rhinoplasty.
Yeah, I'm going to fight. I single-handedly will beat the ENTs.
Like bring rhinoplasty back to plastic surgery. Any of these statistics really stand out to you?
Not really. I mean, yeah, it's kind of, you could see the progression. I mean, the breast aug is the one thing. Definitely that's going down. That was surprising to me personally.
Yeah,
but
4%.
It's not a huge percentage down.
I mean, it's still up 41% versus the year 2000. So in 20 years, we're up 40%.
Right. Other than that, there really wasn't much that really stood out to me. It's been kind of fairly steady throughout. Yeah, there wasn't much there. I mean, things we've talked about in previous episodes. It's really interesting to kind of look at things that are less common. Like we talked about buttocks lift.
Pec implants.
Yeah, pec implants. And those are like less than 1,000, I would just love to know the areas of the country where that's common. I wish they would give locations.
They do.
On procedures like that. Like, okay, cool.
They do. Yeah,
we'll
that's
take a look
further
at that.
down. One of the things I found really interesting was that there's still so many people doing lip augmentation without filler. So the amount of lip augmentation without filler, so meaning like a lip implant,
It's
is
huge.
still over 30.
Yeah, and it's always like the
31,000.
older plastic surgeons doing it. It seems
So
like.
weird. And man, those lip implants are freaky. Like
Well,
they're
that's
so
your
weird.
opinion. I mean, the people that get it and like it, they don't feel like they look freaky. Okay. Yes,
They're
got a lot of hate getting thrown around.
Yeah, they're a little unusual. Like a lip implant is a definite.
Well, there's a reason we don't do them.
Yeah.
How about that? We'll say that.
Well, I mean, there is a place for them, absolutely,
Yeah.
and the reconstructive side for sure. I mean,
Oh,
if you
yeah.
have an injury that destroys your soft tissue of your lip, I mean, a lip implant can give you
Yeah.
back a normal appearance.
Yeah.
Absolutely. Like I'm not a hater of lip implants. I guess I'm just more surprised that mostly because filler has become so commonplace.
Yeah, well, so I like and I get it. Like they just don't want to keep doing filler, but fillers last so long now.
Yeah.
And they're reversible. And
they don't run the.
Yeah.
I mean, you do run the risk of damaging some of your own soft
And I guess
tissue.
fat is kind of hard in the lip.
It's really
It's
hard.
going to be difficult, but it works if you go to the right person. So
Still fades over time, though.
yeah, but I would like be more inclined to do fat transfer than I would the implant. The thing about the implant is once you put it in, and if it's in the right place, it's going to stay the same. The problem is you can get scar tissue around the implant. We've seen that. We've had to take a few out.
Yep. Yeah, they can just become problematic, like any implant. Like we always tell people, like no implant is
Again,
a
I
permanent
guarantee
implant.
lip implants are huge, like in Florida and California.
Probably.
Yeah.
I mean, our lipstick, I mean, like everywhere else on our body, we lose fat as we age. So your lips, you definitely lose it, and you lose the kind of the color in your lips as well as you age. So you see why people would want to do it.
Yeah, well, we lose fat in places we don't want to lose it, and gain fat in places we
Yeah. We
whatever,
don't want it.
Don't want it. Yeah.
Cool. One other thing that I thought was really interesting, and this isn't so much in the last year, it's more in the last 20 years, was brachioplasty or arm lift has gone up like, what is that tiny number? 5,300%.
Well, that's because of bariatric surgery.
Potentially, but this is from 2000. This isn't from a really long time ago. I mean, bariatric surgery has been performed for longer than that, but
I hate to tell you, I was in surgical training when this stuff started becoming in vogue.
Yeah.
And it was like early 2000s. So that makes total sense.
yeah, but went from 300 to
Yeah.
18,000. Yeah, that's a huge
Yeah,
jump.
and we had an episode on brachioplasty.
Mm-hmm.
Yeah, so check that episode out. It's really good. And I said in there, when I trained, we would have the patients stay for like 2 days in the hospital. We had to monitor them, check their pulses and stuff. And it was like inane, right? So now we do it. They're like, oh, you just go home the same day.
outpatient,
It's
yeah.
outpatient. The patients do this fine. I think that was because it just wasn't as common back then.
Yeah.
So,
Yeah.
and I'm talking about 20 years ago. So I'm dating myself.
Well, I want to talk about, okay, there's one more that's weird on here that goes with historical data is hair transplants.
Oh, yeah.
Now, it's actually gone up in the last year, but it's gone down overall like 40+%.
Do you see Nils's eyebrows go up when we said hair transplants?
Nils has a lot of hair. No, but I mean,
He's
that's
got a little male recession on that.
but that's kind of an interesting thing too. And like, why is that? Are we more accepting of baldness now? Maybe.
Are you saying that? No, you're saying why is hair transplant going down per the ASAP data?
Yes.
Oh, it's because everyone else and their mother is doing hair transplants.
Right. It's kind of the same thing
Yeah.
with rhinoplasty.
Yeah.
It's down 40%, not because people aren't doing it anymore, but
It's
because plastic surgeons aren't really doing
Yeah,
it
yeah.
anymore.
No, man, this is all a turf battle.
Yeah.
And people don't think this is about money. You need to wake up. Like every other subspecialty known to man that's not like nephrology and oncology
Yeah.
is trying to do all these things that are
Self-pay.
elective and for money.
Mhm. Yeah,
you know,
self-pay procedures
on the
are
side
big.
on a Friday after their regular job. So, I think that, but hair transplants are huge now. But, the technology in hair transplants is so much different.
Yep, it's improved so much.
Yeah, they have those like robotic micrographs that they do. And so if you're just a standard physician, you could probably get one of those. And you really don't have to do anything technical like we used to as plastic surgeons.
Yeah, you're just like full on grafts or other like crazy
Right.
things. Yeah. So this is the next slide is talking about the cosmetic procedures. Now there isn't as much change here, up about 1 million overall, so about a 1% increase in the past year.
Yeah.
So not a huge change. Obviously, our number one thing here is Botox with well over 7.5
Yeah,
million
that's like the
people.
behemoth.
Yep, getting Botox.
It's like the Michael Jordan of procedures.
And this, again, is only with plastic surgeons. So imagine, I mean, there are far more probably non-plastic surgeons doing these procedures than there are plastic surgeons doing them because of money.
And I guarantee Allergan, who makes Botox, took PPP money from the government. I guarantee it.
Yeah.
Well, maybe they didn't.
I don't think so because they were bought out right before. By a different company. But
they're like, all of our patients aren't injecting Botox like they normally can because of COVID. Yeah, it's really interesting how common Botox is.
Yeah, between Botox and filler, I mean, that's 9 million,
a big
10
portion
million.
of the aesthetic procedures that we do as plastic surgeons.
Yeah, the other ones, I was surprised that chemical peels are so high. I mean, with like 1.4 million people having a chemical peel last year.
Yeah.
With a plastic surgeon.
Yeah, well, so number one, that's the older plastic surgeons
Yeah.
always do the chemical peels, and they tell the patients how amazing they are because they learn, because it's been around for 20 years. And
The
then
Jesners, they're doing the Jesner peels.
And the cotton oil, whatever stuff. And then, I mean, the other thing is there are some newer chemical peels like the Vi-Peel and stuff that, people that estheticians use in these plastic surgeons' offices that work really well. So, and chemical peels work.
They do.
Yeah.
Yeah. Peel it off, slough it off.
Yeah.
Yeah. Other things like IPL are also, really popular. And so is laser hair removal. And I'm surprised laser hair removal is not higher. And it actually went down 4%. So maybe all the people are just hairless now.
No, maybe there's a
all
cultural
out of
shift
hair.
with hair. Maybe hair's making a comeback.
I don't think it is. I don't think hair's making a comeback.
Well, that's your personal preference. You don't have your ear to the street like I do.
Hair's making a comeback.
Yeah,
huh?
it's making a comeback.
Yeah. But those are kind of the top for the, cosmetic procedures.
I know a lot more than Amy knows.
You do. You're way smarter.
Yeah.
So our top 5 cosmetic procedures in 2019 were still breast augmentation, liposuction.
I don't think breast aug's ever going to get taken over, but maybe lipo will take it over. Eyelid surgery at number 3.
Up 2%.
Yeah, that's crazy.
Mm-hmm.
That seems like a lot. And that doesn't take into account the ophthalmologists.
And oculoplastics.
That are basically ophthalmologists or oculoplastic surgeons or ophthalmologists that did special training. And then rhinoplasty is high, which is awesome.
Number
Makes
4.
me happy. And facelift. I mean, like all the ones that we do, we do the top 5.
Yeah, these are
Or
kind of our top 5
special,
surgeries too. I mean, tummy tuck would be in our top 5 though.
Yeah.
Tummy tuck would probably bump rhinoplasty just purely numbers wise.
Yeah, that's true, for sure.
Because there just aren't as many.
Yeah.
The top 5 cosmetic procedures, we talked about Botox and filler are number 1 and number 2, chemical peels 3, hair removals 4, and then IPL. So targeting brown pigmentation, specifically IPL, also is great for texture.
If you ever
tone.
watch our YouTube channel, you can see Amy and I, and just imagine we're the ones that need IPL, fair skinned people with like
all
freckles.
freckly.
Yeah.
Chemical peel would help with that too. So those are
Maybe
the,
after this episode.
right. Go IPL me.
Yeah.
Plug it in
Okay,
right now.
let's do it.
Plug in that
We should
Cutera.
do an episode me IPLing you.
IPL is kind of like being snapped with a rubber band 1,000 times.
I'm not a big fan.
Yeah, I mean it works though.
Yeah.
Yeah, it works. So let's talk a little bit about reconstructive procedures. We had a podcast. Was it this year or kind of end of last year?
It was
We talked
last year.
about breast reconstruction.
Yeah. It was last like August, almost a year ago.
Wow, time flies.
Yeah. That's nuts.
Yeah. So breast reconstruction, is obviously something that we are passionate about. We did a podcast about it. Dr. Martin definitely does a lot of it. It's still pretty high in the numbers. If we look at the top 5, tumor removal, so that includes things like skin cancer removals, is number 1 with over 4.5 million. And that's, again, done by plastic surgeons. That doesn't include dermatologists,
Nope.
other
Mohs.
general surgeons doing tumor removals. Like this is just with plastic surgeons, 4.5 million. That's high. Laceration repair, obviously, little cuts. Maxillofacial surgery, which we just came off trauma call. You're actually headed to do a mandible repair right after this podcast.
Yeah. Come on.
It's number 3. Scar revisions, number 4, and hand surgery. Hand surgery, I feel like, is not done as commonly by plastic surgeons anymore.
Yeah, but so there's special fellowships. Like
Yeah.
I went to the Cosmetic Fellowship. There's special fellowships for hand.
Yeah.
And they're actually pretty critical now. Like you can't take hand call. You can't be a hand surgeon or do hand surgery without having the special certification in most places. So, hand surgery is definitely a subspecialty. And I'm so happy that plastic surgeons are still doing this because orthopedic surgeons, again, turf battle, everybody wants the money. They try to lay claim to it. And plastic surgeons historically, especially with the reconstruction part, were the innovators of a lot of these surgeries that we're doing for reconstruction. So I don't think we should give that up.
Yeah, well, we're fighting for hand
This is
surgery.
a war.
Yeah. So one of the things that stood out to me, we talked about this before the podcast, was I saw this, I'm like, oh my gosh, like dog bites, like look how much it's gone down in 20 years. It went from like 43,000
This is better training
to 28,000.
Yeah.
I'm like, do people just not have violent dog breeds anymore? Like, wow, all these restrictions really work. And then you see this tiny little asterisk,
which you can't even see.
You can barely see it. And what
Yeah.
does that tiny asterisk say? It says that data before 2010 and before were all animal bites.
Like ostrich,
Bird, cat,
Wolverine.
yeah, iguana.
Yeah.
All animal bites were grouped into one. So I really wonder what the real dog bite number was in 2000. We'll never know.
I've been bitten by a dog.
Really?
Yeah, I put my hand over the neighbor's fence, just saying something to him, just like casually, and their German Shepherd with like full on Cujo reference that young people don't know, and the dog jumped up and just latched onto my arm, and the neighbor was just staring, not even yelling at it. I'm like, are you gonna,
You can do something with your dog?
Is there some like German Shepherd command you say, let go of my
Release?
neighbor?
Yeah. So,
it's not fun. It's not fun.
my mom was bitten when she was pregnant with my brother and has been like scared of dogs ever since.
Yeah. It didn't break any skin. Dog bites are really bad. And, that's a big thing that we repair in the operating room, which is dog bites to the face. And unfortunately, it's kids. I mean, it's just devastating. And
eye level.
They're at the same level. The kids don't have the normal fear they should have. It's usually a relative's dog.
Or friend,
this is anecdotal, but this is what we see at least. And the kids don't know any different. And they're 2, 3, 4-year-old kids, and the dogs get bit. So word to the wise, watch out for the young ones around other dogs that they're not comfortable with. That's crazy. How many dog bites were there?
Last year, around 28,000.
Jesus.
Mm-hmm. Yep. So up 5% from the year before. So I'm guessing that the trend has been rising since 2000. We just don't know for sure because of the all animal bites statistic there. All right. So then this breaks down the men to women ratio, which is interesting. It breaks down every procedure, but we'll just do the top 5 just to keep it easy. So for women, top 5 surgeries: breast augmentation, liposuction, eyelid surgery, rhinoplasty, and
Tummy tuck.
Tummy tuck. So we changed out facelift for tummy tuck, which again is for women specifically. Those are definitely our top 5. I would actually we'd probably go breast aug, lipo, tummy tuck, eyelid surgery, rhinoplasty.
Yeah, for sure.
If we were to redo these, but that makes a lot of sense, right? Those are the things that women are into, and they've all pretty much gone up, except like the only thing that's really gone down, like we talked about, is breast aug and rhinoplasty statistically, but by very small amounts.
Yeah.
Let's take a quick break before we start talking about the guys. Before we start talking about men, we'll take a quick break.
So we're gonna have everyone wait to build up a crescendo.
Yeah. So if you want to hear about
what
men,
are the guys doing?
What are the guys doing in plastic surgery? Come right back. Dr. Martin, I'm super excited to talk about our sponsor for this podcast, Let's Get Checked. If you've been a listener of our podcast, you know that we have never had a sponsor before, and that's because we're an educational podcast. We're not looking to monetize, and we also would never recommend something that we didn't believe in and or use ourselves.
So basically you're saying we're very choosy.
We're very choosy when we come to our testing, but Let's Get Checked really aligns with our values. We talk a lot about monitoring your blood values of certain things. We talked recently about vitamin D serum levels. We talk a lot about hormone levels, and it's hard for some people to get to a lab, or you're afraid of the blood draw, or just, you're concerned about confidentiality. Like you have a lot of concerns and you just don't do it. Let's Get Checked makes it super easy because it's completely confidential. You do it from your home. So there's really no excuse not to do it.
Yeah, and we did it recently. Both Amy and I did it. She looked at her women's health, basically her hormone levels, and I looked at mine on the men's health side with testosterone. It was very simple. You go online. Their online interface is really easy to use and good. We got the testing kit very quickly, and the test itself, actually doing the stick, you do a stick on the end of your finger, is not hard to do. It only took about 3 to 4 minutes. You put it back in a sealed envelope that's confidential, goes back to them. You get your results in 2 to 5 days. It's really that simple. And the best part is it's about empowerment, about you taking control and trying to do things that are positive for your health and life. And this is one way to do it, literally from the comfort of your own home.
Yeah, so they offer a wide range of tests. So they do men's and women's hormone panels. They do a full panel of STD testing. They also are now offering a COVID-19 test at home. So there are a lot of other just basic blood levels that you can get tested as well. And one of the things that we always say is you can't track what you don't check. So you might not know what's normal for you in the future if you're not checking it now, especially as it relates to hormones. And men's health specifically, I feel like, is a little bit undertreated. I mean, sperm counts are dropping by a large percentage in men these days. Most men struggle at some point in their lifetime with low testosterone.
And those men do not know what the symptoms of low testosterone are. Depression, anxiety, sleep problems, osteopenia or loss of bone, loss of muscle, and something we treat all the time, gynecomastia or male breast growth. These are real problems that can be that can be improved or treated with testosterone. And these men do not know their levels. It's so easy to get checked. And this is why we're so excited about the sponsor.
Yeah, and Let's Get Checked is a completely CLIA certified lab, the CLIA lab. So they're a well-established, completely safe lab to use. You do get contacted after, so you get your results. I got a text at 4:30 in the morning, which I loved, that my results were ready.
And we're both up at 4:30, so that was good.
Super excited. And you have access to not only a nurse, but also a physician. So a physician does review your results, and it gives you a little breakdown of like where you're sitting on those levels. Dr. Martin's had even comparisons of like where two of the levels should be in relation to each other, which is a really important thing to note.
Right.
Just being within the normal range is not always enough. So it really gave more information than that. You'd still want to, of course, reach out to your own doctor if you needed some additional assistance with these labs or you did see something that was concerning. We didn't, thankfully, so that was good.
Yeah. We were both good. This podcast is about empowerment. It's educational. In my private practice, I'm a board certified plastic surgeon. We are all about empowerment, and this is one way to do it. So we're very excited about the sponsorship, and we're looking forward to using it for our patients moving forward.
Yeah. So as a listener of our podcast, if you're also a new time user to Let's Get Checked, which a lot of you probably are, we do have a 20% discount code. So you do need to go to our specific URL, and it is linked in the description box below, but it's going to be TryLGC, so TRYLGC, like Let's Get Checked.com/beauty, BEAUTY. And you'll need to use the code BEAUTY20 at checkout. Beauty again is BEAUTY 220. And you can pick a test, like any test you'd like, put in our code and get your test shipped to you. Getting tested is the right thing to do. It's lets you know where you're at and what's responsible.
All right. Well, let's get tested.
Let's get tested. Let's get checked.
Let's get checked.
All right. So for those of you who stuck around to hear about men, let's talk about the men.
Yeah, let's talk about the guys.
So what are men doing
dudes
for plastic surgery? The top 5: rhinoplasty,
right?
Eyelid surgery, liposuction,
Yep.
gynecomastia or breast reduction,
Which we do a ton of.
and hair transplants.
So for us, breast reduction would be number 1.
Yep.
Rhinoplasty would be number 2.
Oh, I'd probably say lipo.
Yeah, lipo number 2, eyelid number 3, rhinoplasty number 3. No,
Eyelid 4.
Eyelid 4, and then we don't do hair transplants.
So what would our number 5 be?
Oh, that's a tough. That's
For
a tough
guys?
one.
I would say it's facelift.
Probably neck lift.
Definitely
Yeah.
neck lift. Yep. Yeah, or some combination of neck procedures.
Yeah,
so whether that's
something for saggy.
Yeah, so whether that's face tight, like
Yeah.
face tight with a little we love doing our W-plasty. Definitely for us, I mean, we definitely have a large proportion of male patients that do face and neck lifts
Yeah.
with us. Yeah.
I feel like we should branch out to do like a whole commercial campaign on, for men and
That
cosmetic
was
surgery.
my point about that podcast about plastic surgery for
Yeah.
men. Like these are options
But men
for
don't
you.
even listen to podcasts, it seems like, either. They don't. I mean, besides Nils.
And you listen to
I
podcasts, right?
listen to them all the time.
Yeah. So, and hey, the reason I found out about podcasts was Canyon, because he listened to him on his way home from school.
That's a good point.
So yeah, like he's the one that got me into podcasts.
Yeah. Maybe there's a whole group of men out there listening to podcasts. They should group together and start like some group of podcast listening men.
I would have to say, I think statistically, and I'm just guessing here, there are probably more men that listen to podcasts than women.
That's true, but the ones they listen to are the ones that Nils and I listen to, which is basically anything science or nerdy related or something with comedy, basically.
Or sports. Well, that's me.
Yeah, sports too. I mean, I think sports is a given. That's probably its own subset, but yeah.
Yeah. So we fall somewhat in line with these. We're not totally. We kind of have reorder them, but I think that's pretty normal overall. I mean, another surgery that I think is an interesting one that we have done probably more of than I would think people might think for men specifically is thigh lift.
Yeah.
Men don't tend to have a lot of laxity on their legs. Just genetically, their legs tend to be thinner. Even when they gain and lose weight, they tend not to gain and lose a lot of weight in their lower half, where women tend to gain a lot of weight in their lower half. Men don't. But we've done and continue, I feel like, to have men that come into our office that need thigh lifts, which is...
Yeah. And we have a lot of, or not a lot, but we have a decent amount of post weight loss patients. Men who've had bariatric surgery or weight loss surgery. So
yeah, so these are all, every surgery that is an option for a woman is an option for a man. Literally everyone. We'll talk about that in a moment. I think is that our next slide? No. Oh, we're talking about regions next.
This is
what
good.
you wanted to talk about.
This is really good.
The regional distribution.
So I've lived in lots of places. I've lived in Chicago, which is the Midwest. I've lived in New York City, which is the East Coast, kind of the Eastern Shore. I've lived in the South. I grew up in Kentucky, so it's right on the border. So I kind of got that vibe down there. I live in the Mountain West, which is Colorado. I've lived on the West Coast, which is Squaw Valley and San Francisco and Lake Tahoe. So pretty much everywhere. Mm-hmm. And it's so interesting because the cultural differences in all these places is like huge.
Oh my goodness, yes.
Yeah. I mean, even the difference between Chicago and New York.
Well, that's a huge difference.
Totally different.
I mean, we're really, when you think about it, Chicago's kind of in the middle. That's like saying there's a big difference between Chicago and LA. I mean, so obviously.
Yeah, when I went to New York for trading, they were like, "Oh man, you're kind of a hill jack. You grew up in Kentucky and lived in Chicago." I'm like, "Chicago's kind of a big city." They're like, "Yeah, not really."
Still the Midwest.
No, not really.
So you've lived in 3 regions that we're going to talk about. So right now, in Colorado, we are in the biggest region for plastic surgery by number.
Right.
But we also get to include California in our state. So we're basically, if you think of taking Colorado and going New Mexico down, New Mexico, Arizona, and then Wyoming, Montana up to the west.
Yeah.
Those are the states that are in the Pacific West.
So you get a little Idaho, you get Washington State, Utah, Nevada. California. By the way, per capita, the most plastic surgery in the United States is in Utah. You guys figure that one out.
Yep. We also get Alaska and Hawaii.
Yeah.
So we're in Region 5 now. You grew up in Region 4, in Kentucky region, and then you worked in Region 2.
Right.
And in Region 1. So the only one you haven't done is Region 3, which is pretty much just Florida, the Carolinas.
I just don't fit in down there.
Yeah.
I'm not a Miami guy.
You've done everywhere else.
I try to do the Will Smith thing, You
got all the regions covered. But it's interesting to look at how the regions break down. So Region 5, where we are, is on the far side. What I think is really interesting is the breast aug numbers. Like, we get 107,000 out of the total of 300,000. So we're a third of all breast augmentations in our region.
That's like 90% California probably.
Which is crazy because Florida, you kind of think of as like big city for breast aug.
Yeah.
Or big city. Yeah. I know the things. I know the geology things. Big
state. Big state. Yeah, no, you would think so. But California is huge. West Coast, man, it's just like cultural there.
Yeah.
Everyone gets augmentations. It's interesting.
Some other really standouts here, I think, are the ones that are highlighted from them are obviously eyelid surgery, 71,000 out of the 210,000-ish or 211,000 is big. And then also facelifts. We have the biggest proportion of facelifts, which again, I found interesting because you kind of think facelift, you think New York,
no,
you think Miami.
Well, you think that because of my training, but in reality, like most people think of facelifts as that gauche, really pulled tight facelift, and that really came from the West Coast. Man, that's in vogue there.
That one, yeah. But I think just
the East Coast demure kind of high class facelift, which the way I was taught is less common, right? Because it's subtle and stuff like that. So, I know we're totally throwing California under the bus, and there's some really good surgeons there that do a great job. But historically speaking, that's where that came from. That over-injected, super tight facelift kind of result that people look at and are like devastated when you see it. That came from the West Coast. That didn't come from Florida in most
Palm
cases.
Springs, pull it till you can't pull anymore.
Yeah.
I don't know. Yeah.
That's my belief.
Yeah. Well, in Hollywood, so that desire to stay young and like look young. I mean, we can't discount the effect that has on plastic surgery as well.
Well, it's called body dysmorphia, but that's
oh, you mean Hollywood?
Yeah.
Yeah.
We just basically doxied whatever it's called, the whole state of California. They're never going to listen to us again.
California's awesome. Like they're all natural. And
yeah.
amazing.
To the credit of the California peeps, there is a lot of weird stuff that comes out of there, but there's a lot of innovation that does too. And there's some amazing surgeons, some of the best facelift surgeons come out of California. I think that it's just a mixed bag.
Yeah. The interesting thing about eyelid surgery, even though there were the most in our region, it's pretty well distributed throughout the regions. And so is breast augmentation. Like if you look at the percentages for everyone else, like it kind of breaks down evenly throughout most of the rest of the regions.
Yeah.
So, it's a fair distribution on a lot of these things throughout the rest of the country. One of the things I found really interesting was dermabrasion. So dermabrasion in Region 2, which is like our very Midwest, like Chicago, like Wisconsin, Minnesota.
Why do you think that is?
Nebraska. I don't know.
But they're all Caucasian there.
Well, that's a jump.
No, I'm not trying to be polarizing here, but like, have you ever gone there? It's like, there's diversity obviously in Chicago, but in general in those whole areas, they tend to be fairly Caucasian, like that Northern European type person. And those people you can dermabrade till the cows come home and not worry about hypo or hyperpigmentation. You go down to people with darker skin, more melanin, on the coast and like Miami and stuff. They're not great candidates for dermabrasion for that reason.
Well, but remember, this is talking about
I like my
non-invasive dermabrasion. Yeah.
Yeah.
I mean, we're not talking about like the old school, like, what was that with the oh my gosh, that metal tip thing you touched on my skin, there's blood flying everywhere.
Yeah,
We're talking more about modern day dermabrasion, but still, I think perhaps those other places are doing more chemical peels.
Blood flying everywhere is a little extreme.
Like, bring out the sander.
It felt like that.
Yes, it looked like that.
What's the little wood tool?
It's a Dremel.
The Dremel. Yeah.
That's what that is.
It literally was like a Dremel.
Metal.
Yeah.
So terrifying.
And it had a metal tip that they would clean, and you would sit there and you could change the RPMs on it.
Speed.
And just basically sand down the skin.
Yeah. Or you like for abrasions. Oh my gosh, there was a doctor who used our office for a while who was very fond of the Dremel.
He loved it.
Oh my gosh. You think they were like a biohazard zone when we get done in there. I'm like, I will like wipe the blood off the walls.
Yeah.
Any other regional specifics that kind of stood out to you as being
shout
interesting?
out to the Mountain West and West Coast. I think Region 5 is winning the game.
Well, we're definitely winning the numbers game.
That's right.
But
come at us.
Yeah.
We're ready. Miami. Atlanta. Come on.
Rhinoplasty was another one that was pretty well distributed amongst all regions, which I thought was pretty interesting too. Like, again, our region, Region 5, has the most, 27% of them, but the rest of the regions, it is pretty evenly distributed.
Basically, Region 5 is like SEC football.
Yeah, it's just taken over.
Colorado's not like Alabama, right? So we're kind of like Kentucky, How
do you think Alaska feels? They're part of this, and they're like, we don't even have that many people in our state.
Yeah.
More people had breast dogs last year than live in the whole state of Alaska.
Yeah, that's pretty sad.
Well, it's not quite that bad, but it's close. Or like 500,000 people in Alaska. I'm going to stop
coming from the person that grew up in a town of like 500. Okay.
That's true. There were dirt roads. Okay. This is then for the cosmetic procedure or minimally invasive, which we're talking about surgery here. So we're going to skip over that one. This slide was interesting because it talks about the demographic of the patient who has plastic surgery. And what I found really interesting was they broke down the amount of patients who are repeat patients, which was 38%. So 38% of the people who had plastic surgery in 2019 had something done before. The amount who are having multiple procedures done, which is very common, was over 40%. Patients who were repeat patients, I think is pretty common, like have had something done before, maybe not surgery, but we're coming back and having something like maybe at a breast aug, they've been having Botox, that kind of thing. So it does show that there are people who, we talked about this with a patient today, and I always say like it's a slippery slope, right? It's like the stars in the sky. You do a small cosmetic procedure, like let's say you even do like a little bit of liposuction, you're like, oh my gosh, it worked.
And then you like the surgeon, you like their staff.
Like maybe I should do a breast aug.
It is.
Maybe I should have a facelift. Like because you realize it works. Like I'm going to bring my husband and get his ear fixed. Like all these things kind of build on each other.
These poor husbands get drug into my office all the time. And the wife's like, God, look at his neck. And he's just sitting there like a deer in a headlight.
It's hideous.
He's like,
you've got to pull that.
I don't think it's that bad. And she's like, oh, it's terrible. Like, you got to do something about that.
I can't look at it anymore.
Yeah.
Yeah. So it's interesting. And then what you found kind of cool was the breakdown of whether the procedure is performed in an office, in a hospital, or in a ambulatory surgery center.
And so, we do ours in a hospital, and that's because of our volume. We're so busy. But I would think that the ambulatory surgery center would be the most, and that's what it is, almost double what hospitals are.
Yeah, about 40%. So higher than office or hospital.
Now, we do tons of office-based procedures too. So, yeah, it's just interesting. And that, awake surgery is definitely safer no matter what anyone says than non-awake surgery. Now, the difference is not major, but there is a difference there for sure.
Yeah.
So awake in-office surgeries as opposed to a sleep surgery in some sort of surgical facility.
Yeah, when you look at the numbers, I mean, the percentages seem high, but like the actual number amounts aren't really all that high. The amount in office was about 6.8 million. The amount in a surgery center was about 7.3. And then the hospital was like 4.5 million. Yeah. So a lot of these procedures are being done in hospitals because they need to be done in hospitals. I mean, we've talked about that before. Like there are procedures that we do that require an overnight stay, sometimes even 2 nights. Like if you're combining surgeries, like the amount of people who are combining multiple surgeries at the same time, and you're having a surgery that's 6-7 hours, that's really the safest to be done in a hospital. And there are benefits of that. I mean, we, for a long time, did work in a lot of surgery centers because they're convenient. It's easy, it's chill, it's super easy to get in and out. But then you see that if you're going under, you might as well be going under in a facility that can really take care of everything if you need.
And this is our opinion.
Yeah.
You may have a surgeon that doesn't believe that.
And surgery centers are great.
Surgery centers are great, but we like the fact that we work in a place that's like a high-end hospital, but also has an ICU. God forbid something ever happened. And knock on wood, never has happened, but you never know. Thanks, Nils. And so having that comfort level for the patient is really important, especially, to be honest with you, I know we're not supposed to say the word COVID, but post-COVID, going to a place that has a set system in place for your safety specific to COVID is really, really important. And surgery centers are not well equipped for that. They're not. Yeah. You can have an outbreak in a surgery center. So, and the hospitals can handle that better.
Yeah. And they're bigger. They have more ability to separate people.
More money.
Yep. More money for PPE, like more money for everything. So
again, we're not supposed to talk about that. Sorry.
But one interesting thing that was a new statistic this year, because it's just comparing the last 2 years. So 2018 to 2019 is body contouring after massive weight loss. And I thought this was really interesting. The other graphic on this page is about gender confirmation surgery. And these are, again, new statistics that we haven't had in the past. So like they're pretty cool to look at, like the change in just a year. I mean, obviously it's not a lot of data to look at, but to see that is really interesting. Specifically, the things that they group into this category for after weight loss is breast lift, lower body lift, thigh lift, tummy tuck, and brachioplasty. And the numbers are maybe not as big as you might think. We talked a lot about the change in brachioplasty being related to the incidence of weight loss or bariatric surgery. Of the, 30,000-ish, 31,000 brachioplasties, 7,500 of them can be contributed to massive weight loss.
Well, that's a lot.
Yeah. That's
25%.
Yeah, that's a good portion. And, whether or not that was through weight loss surgery or just losing weight on your own, like it's interesting that they're tracking that now. I think that's a really cool one that we can continue to follow, for the next 20 years. If we're still doing this in 20 years, like you did a good job. Like we figured out
Nils is going to come in one of those scooters.
Yeah, a hover around. Yeah.
Your elevator wasn't working.
We don't have an elevator, Nils. You forgot. And then the gender confirmation surgery was also a really interesting one to look at. And again, it's just 2 years of data, so it's not a bunch, but it is up, and it breaks down the difference between.
I think gender confirmation surgery is so interesting, and, we're changing as a country. And I think that being more open about this stuff and giving people opportunity to transform the way that they feel comfortable with and what they identify with is really important. And I also think it's important to go to a specialist and someone who's board certified for this. So I'm really glad they're bringing these statistics in, because I think it'll open the eyes of also the plastic surgeons to say, hey, you need to maybe readjust your practice and help these people out.
Well, and getting it more kind of above board seems like such a terrible way to put it, but making sure that people know that they have options.
Yeah.
I think historically this was a very underserved community in the fact that there weren't a lot of doctors that were publicizing that they did this.
In the state of Colorado, there was one place that would do it for a long, long time. And it was actually nationally known.
Yeah.
But
in Trinidad.
Yeah, Trinidad, Colorado. So very well-known surgeon down there who was doing this surgery. So I think it's really important that they include these statistics, and I think there needs to be more education on that. Yeah,
and education to the general population that this is something that plastic surgeons are absolutely embracing, and they're a great place to go to for it, because extensive training, like we talked about, to become a member of the plastic surgery board is not easy. Once you've done it, you've had a lot of surgical training, and so it's a great place to start.
Way too much training. Way too much.
Lots. Look at all the knowledge in your head.
Oh, great.
You got lots.
Yeah.
So much going on.
So if I had Jeopardy only on plastic surgery, I would win every time.
Oh my gosh, plastic surgery Jeopardy. I don't know what kind of Jeopardy I'd be good at. Maybe like random song lyrics.
Hip thrusting Jeopardy.
Yep. I could hip thrust. Yeah.
Anatomy.
Yeah.
Well, that was pretty good. That was actually really interesting. So Amy and I love statistics, and you can see there really hasn't been a lot of change. You can see, unfortunately, rhinoplasty is going down. I think there's a turf battle. So I'm just gonna put everyone on notice. All the ENT surgeons out there, I'm coming at you.
We're bringing rhinoplasty back.
I'm trying to think of a movie where the one guy goes out there and fights the whole Game of Thrones.
Oh, see, I haven't watched Game of Thrones.
Yeah, what's his name? Goes out there and he takes the horse and he goes.
Jon Snow?
Yeah, Jon Snow. Yeah, that's me coming after the ENTs.
You're Jon Snow. That's your spirit animal. All right. Well, thank you, everyone. If you made it to the end of this podcast, we really appreciate you listening, and we hope that you found these statistics as interesting as we do. We definitely find statistics interesting, and if you did want to watch the video, now that you've listened, if you just listened and you're like, wow, I really want to watch the video that went along with that, you can find that on YouTube at Jason Martin MD. We're also on Instagram at Beauty and the Surgeon Podcast. We have something else that's really cool. We actually have a voicemail line now. Yep, people still leave voicemails. Like, please leave me a voicemail, actually.
But don't do it like late night. You've had a couple drinks. Maybe just be coherent when you leave the voicemail.
Right. Well, if you'd like to leave us a voicemail, I'm going to give you the number now, but you can also find it in the show notes and probably in our Instagram feed as well, like in our Instagram description box. It's a Denver number, so it's 303-630 9038. I had to look at it because I'm really dyslexic. So that will be in the description box. So we'd love it if you'd leave us a message.
Or text. I think it takes text too.
It does take texts, but leave us a message.
Yeah,
We
leave
want
us
to
a
hear
message.
your voice.
We want to hear your voice. And we will answer your questions. And actually, we could even take your voicemails and put it into the podcast if you
So you'd hear
so
yourself.
allow us. So you can see or be famous. You'll be on the Beauty and the Surgeon podcast.
So thank you everyone so much for listening, and we hope to see you next time.
See ya.
Don't forget to check out our sponsor, Let's Get Checked. Let's Get Checked offers fast, affordable, and completely confidential health testing for everything from STDs, male and female hormones, and even COVID-19, right from the comfort of your own home. And remember, new customers and listeners of our podcast get 20% off by using our URL, trylgc.com/beauty, and be sure to use the code BEAUTY20 at checkout. That's trylgc.com/beauty and use the code BEAUTY20, beauty, BEATUY 20 at checkout. Get checked. It's the right thing to do.